It's not digestible well, so I need to go to the store honestly and get the orange bag because I got the pink bag and the pink bag. I need pictures. This ain't right up in there for years. Remember we had a veterinary conversation about which vets to go to for years back down here to Stony. Yeah, the same cat.
I've never seen a cat. That physical exists in my head. I thought you found a stray cat. You just helped it out. No, I only remember there was a cat when you were living over.
Let me know when you're ready. I have my phone. All right, Mama. See, that's what I was telling you. They're not. Did she? I know she tried, but I know it was. Assalamu alaikum. Assalamu alaikum, sisters. We're getting ready to open up with a prayer. So if you guys would please bear with us and listen up so that we can go ahead and begin the program because it's going to take some time and we're already going to be encroaching upon the Taraweeh time. So inshallah, if we can open up. Bismillah ar-Rahman ar-Rahim. All praise is due to Allah, the most merciful, the most compassionate. We thank you, Ya Allah, for gathering us together here this evening in sisterhood, in faith and purpose. We ask that you place barakah in this gathering and accept it as an act of sincerity for your sake, inshallah. Oh, Ya Allah, we remember those who have been affected by illness, especially those who have faced cancer. We ask that you grant healing to those who are currently struggling, patience and strength to their families, and comfort to all those who carry this burden. You are Ash-Shaheed, the ultimate healer, and we ask you to send your mercy and cure upon them. Ya Allah, we also remember our dear sister Nadira Stevens Ali, whose vision and dedication helped establish this Pink Iftar as a way to bring awareness, compassion, and action within our community. Reward her for her intentions, forgive her shortcomings, expand her grave, and grant her the highest place in Jannah. Let her legacy continue and inspire goodness in all of us.
Thank you. Alhamdulillah. Alhamdulillah. Allahu Akbar. Thank you so much, Aisha, for that. And we'll go ahead and get started. Assalamu alaikum, sisters. Assalamu alaikum. Assalamu alaikum. That means you guys can hear me. Okay. My name is Michaela Muhammad. I am going to just go over a few.
I gotta move that car.
Oh.
There's a gray Nissan crossover.
Gray Corolla crossover parked in the entrance.
Who's driving a gray Toyota crossover?
The tag is
CCE 2908. The tow truck is on the way. Last call.
Last call.
Gray Toyota crossover. Anybody? All right, thank you. Excuse me, I'm sorry.
No problem. Okay, part 2. Ramadan Mubarak. I pray that our spirits are high today and that we have started to receive the blessings of the days of mercy and the days of forgiveness as we seek freedom from the hellfire. Tonight is also our night for fast observing the night of power, so we will have another powerful evening of presentations. But to just go into kind of what I have for you today, just a little bit about me. I've had my entire career working within cancer research or oncology research for the last over 20 years. I have advanced the case of care for patients and families. I have worked from diagnosis through treatment, through grief and counseling, the whole gamut. So cancer is a very diverse disease, and so we want to try to empower everyone this evening so that you feel more equipped to know how to handle things. Okay? So today is about health advocacy and cancer care. Okay? So let's just start at the beginning. Can you hear me okay? Okay. So what is cancer? I hope everybody can see that, the post okay. So cancer conjures up a lot of ideas and feelings and emotions, but cancer is a disease that's caused by an abnormal cell growth. So normally our cells will grow in a very systematic pattern, but in cancer it'll start to change that pattern and either rapidly increase or decrease one way or the other. And we have millions and millions and millions of cells within our body. So within that case, cancer can have a opportunity to grow. And then as well, as cancer grows uncontrolled, it can invade other nearby tissues. It can start almost anywhere in the body. It can spread, or you may hear the word metastasize. That just means that it has gone from its initial location to a further location outside of the body or within the body. Not all tumors are cancerous. Some are benign and some are malignant. And just because it's benign doesn't mean that you don't need to do anything about it. And just because it's malignant doesn't mean that it's like a death sentence or anything. So I just want to dispel that thought right away. Cancer is not one disease. I know when we summarize, we can sometimes say, oh, well, this person has cancer. But it is an array of diseases. And so we have to be sensitive to that, and it'll be treated accordingly. And number one, I definitely want to highlight that cancer will not just go away on its own. We can't ignore it. I know within our community, sometimes we feel afraid that we don't want to find out what it is, but it will not just go away. So we need to address it. And so that's why we're bringing it up now. So again, I want to just share some signs and symptoms of cancer so that you can be aware. So cancer can start as a change in your bowel or bladder habits. Sometimes you have a discoloration of your urine, discoloration of stool. I know we're having Iftar tonight, but we're all adults in here, so we can just speak. So it could be a change. It could be diarrhea, or it could be constipation. So just any change from your usual habit can give you a signal to think about it. Okay, number two is a sore that doesn't heal. So if you've had a sore over several months that does not seem to heal up, it's oozing, it feels kind of crusty, sometimes it bleeds, sometimes it doesn't, but it just looks a little bit off. That's something to keep in mind. Number three, you can have unusual bleeding or discharge from any opening in the body. So if there's an oral cancer, it could be from the mouth, or it can be from other places. It could be from the skin. But it is an unexpected, unusual bleeding that's happening in the body. Another thing is unexplained weight loss. So we're all, inside here, we're all ladies. So sometimes, hey, I lost a few pounds. That's a bonus. We're okay with it. But if you start losing significant amounts of weight, that's something for you to keep in mind, that maybe I have some other changes going on and I need to start keeping a tracker as to how that weight has fluctuated. If you've lost more than 15% of your body weight or 10% of your body weight, you definitely need to go see your primary care to get that checked out, okay? Or loss of appetite. And that loss of appetite, or I would say even a change in appetite, sometimes you don't want to eat anything, or you just want to eat certain kinds of things. So just again, what is in your usual habit and what has changed. So that's what you want to keep in mind. So when you're talking to other people, sometimes they will say, oh, that you're fine, don't worry about it. You know what your usual habit is, so Allah is giving you a sign to pay attention to that, okay? Number 5, any difficulty with swallowing or a chronic indigestion. So that could be a signal to a lot of different things, but you could have a lump in your throat, or you feel like you can't quite clear your sinuses, or, you know, like when you eat, things start getting backed up. Again, another sign for you to think about it. This is something to keep in mind. Number 6 is going to be an obvious change in a wart or a mole. So just bringing that up, yes, we are African American, and sometimes we assume, we have these assumptions that we can't, excuse me, sisters, I can't hear myself. I can't hear myself. Okay. So if you have an obvious change in a wart or a mole, that's also significant. So sometimes we have a lot of freckles, even as African American women, or if you're fair skinned or have a darker complexion, you may assume that you can't get sunburn or that you can't get, you know, a change in your moles. Definitely pay attention to your skin. Do a skin survey. If you start noticing irregular edges on those moles or anything like that, that's something to keep in mind. You might even want to take a little picture of it if you're going to watch it over time, just so you can see, like, okay, I'm noticing some changes. And then number 7, of course, is a nagging cough or a persistent cough that you can't otherwise explain. Okay, so there are many, many, many types of cancers. Cancer is very unique. It can be regionally based, so literally there can be clusters of cancer that will pop up in certain regions. So you may be in, you know, a certain area, like way out in the country or something like that, or on a water system, a well system, or a tank system or something like that. You're not on regular water from the city. Sometimes there are clusters there. Sometimes there's runoff that may be in the ground. So again, just it may be hazards that you are exposed to that you may not be aware of. Sometimes it's genetics. Some cancers are passed down through your genetics. So this is something within our families that we can't necessarily control, but you can be aware of. And then there could be other unknown factors that are still like under review. So cancer can affect all ages and all stages. And one thing for us to know, it's not your fault if you get cancer. I know a lot of people feel like, okay, I'm getting punished. What did I do? That's not the case. Again, the first slide said this can be an overgrowth or a change in growth anywhere in your body. So this is just something that can happen within just our biology, right? So it doesn't have to be something that will cause shame. So I want to bring that out as well. So early detection obviously is best, and prevention will also help improve outcomes. So part of the prevention is eating properly, not smoking, not drinking. Those are definitely linked to cancer cases. Some of the medications and stuff that you may take or food that you eat can be linked to it as well. So types of cancer, this is just an overview of the primary types of cancer within the United States. So breast cancer is most common in women, but men can get breast cancer. So if you have a partner that is telling you, like your family member or something like that, is like noticing changes, yes, men can get breast cancer. Prostate cancer, this is most common in men, but obviously women don't have prostate, so we wouldn't have prostate cancer, but this is prevalent within the United States. Lung cancer, of course, because of a history of smoking, can be tied, But that doesn't say that you can't get a non-smoking lung cancer. That is a thing. So be aware of that as well. And then colorectal cancer is really, a lot of it is tied to like diet, exercise, more lifestyle driven. So colorectal cancer, so this is going to be of the colon, so that's the large part, and then the rectum is the end. And then we've got skin cancers, which includes melanoma. Some skin cancers are benign, but some of them are malignant, and that's the melanoma, and we want to just get that checked. Bladder cancer is more rare, and then of course the lymphomas. These are blood. This is a blood cancer as well as leukemia. That's also a blood cancer, and they require special attention. You would not treat it the same way as a solid cancer. What I mean by that is something that's in your organs in your body. Okay. The ways that we would diagnose cancer, there's a lot of different ways, but I just want to make everyone aware of what can be included in the array of diagnostics. So you can have a screening mammogram, you can have pap smears, you can have HPV testing. And for men, they would have a PSA test, which is a blood test, or you can do a stool test, which is like a smear. So obviously, early detection is key if you're asymptomatic. And sometimes you may have like a chest X-ray or something like that, and they may see incidental findings. This is just something to be aware of and follow up on if needed. And then other imaging that is a little bit more sensitive, that is going to give you a better picture of what's inside, is the X-ray, an ultrasound. A CT is even more refined view. The MRI and the PET, obviously, they're going to use a different method to take the pictures, but they're still taking pictures. It doesn't hurt or anything, so just be aware of that. If you're claustrophobic, the PET scan, you do have to go like in a tube. So sometimes that is something to keep in mind. But otherwise, these are just some imaging techniques. And then also they can diagnose cancer by lab tests. So they may take a sample of your blood, and they check for special proteins in your blood called tumor markers. Or they may do a biopsy of the area that looks a little bit funny. So again, you know your body best, so direct your care team as to how to best help you. Okay. In order to confirm what the diagnosis is, they're going to go a little bit deeper. So the first one is more like non-invasive. This next level is going to be more invasive. So it's still minimally invasive, but they'll do a little bit more. So they will do like a biopsy. They may take a little bit of tissue, and then they will look at that under the microscope to determine what kind of cancer you have so that they can best treat you. And then there's more sophisticated is genetic testing or molecular testing. This is very, very fine detail and sciences that are related to a full array of testing that will look at what do the cells look like, how are they spread, do they look uniform, do they look irregular, or is it just like it looks like all over the place. So then that is usually a more aggressive type of cancer. And then finally, the staging. If you hear anybody say, "Oh, I was stage 1, 2, 0, 4, whatever," what they're talking about is this TNM, and the T is the tumor size, the N is the nodes. So we have these lymphatic systems. They will check the node and check if there's any invasion there. And then the M is for the metastasis. So if it has gone outside of where it started, let's say it started in your lung and now it has gone to your the nodes that are connected to that, and then it may go to other areas of your body. So like brain or something like that. But not all cancers go to all areas of the body. So each one of them will be unique. So after you've found out your diagnosis, just an overview of like what is the journey, the patient journey like after you're diagnosed with cancer. So first you will receive an initial consult. This is your workup test, and they really are putting together your treatment plan. Don't skip your consult. Don't think the consult is going away. If you leave information out, that's going to impact your care and your outcomes, okay? So trust your care team. If you don't trust them, get a different care team, okay? Treatment plan. So this will be a personalized plan for you. It may include an array of what we talked about was surgery, it could be chemo, it could be radiation, it could be a targeted therapy, or you can have a mix and match combination of them all. So you don't want to say to somebody, oh, well, I had such and such and I didn't have to do that. You don't want to say that because you haven't seen what their diagnosis is, and each person's individual plan is going to be tailored to them. So support and resources. We also want to include counseling, nutrition, any pain management if that's needed, and then regular check-ins, okay? So then after you've done all your care, you're going to go into follow-up and monitoring. That's also critical so that you can stay healthy and on your healing journey. And then, of course, we have survivorship. You're a survivor from day one, so keep that in mind. Don't say that it's over. You're already a survivor because you're aware of it and you're moving forward, right? So we stay in a positive, empowered mindset. And then there may be a need for palliative care. So palliative care is more like we've done what we need to do. We're kind of more at the end of life, and we want the patient to feel comfortable. So, of course, honoring what their wishes are. So in treatment options, we talked about this a little bit, but I really want to call out hormonal therapy. If your cancer is not sensitive to a hormone, you will not be given hormonal therapy. So not all of these therapies are applicable to everybody. Stem cell transplant, that's also another very technologically advanced where they're taking your cells, they'll transplant them, so it's really your body's machinery creating a cure for itself, right? So stem cell transplants sometimes can restart the immune system and then you're moving into remission. Everybody can't get stem cell transplants, so you can ask about it, but not everybody, it might not be appropriate. This is primarily for like liquid tumors, okay? And then of course we have integrative and supportive care. I want to include that because that can include all of our support services like Reiki therapy, if you do meditation, light therapy, all of that, that's all integrative care, and you can include that in your care plan. So it doesn't have to be either or, it can be additive so you can get best outcomes, right? And then for me, I work in oncology research, and so my field really looks at novel therapies, and so please include and consider novel therapies. The FDA's approval rate of cancer treatments is tied to a whole lot of things. So sometimes your best option is going through a research trial. So I understand like our history with the government and etc., but I assure you everything is extremely well controlled and managed. So don't count out a research trial if it's appropriate for you, okay? And this is always going to be tailored to your individual need. So some common side effects, I want to just kind of go over those really quick. Of course, this is just to highlight some things that could happen. Of course, you could have one of these things happen, you could have none of them happen, or you could have an array of different combinations. So commonly you will see if you're using chemotherapy or radiation, you will see some fatigue, and that builds over time. So the first day, I felt fine, I didn't feel anything. Over time, week 3, week 4, week 5, it's like I'm over it at this point. But continue, don't give up. the way the radiation works, it will kind of it treats the cell, and it's like a long treatment, so it goes over time, and then your body starts rebounding. So you definitely want to stay within your plan. Sometimes you can have nausea and vomiting. That can be mitigated. We've done a lot in advancing those side effects so that you don't have that. Only some of the chemotherapies can cause like hair loss. So I know sometimes, especially like with women, if you say, "Oh, I have to get treatment," automatically think, "Oh, I'm gonna lose all my hair." That's not true. Some therapies do make you lose hair. Those are usually taxane-based therapies, but not all of them do. And your hair does grow back, though it may be a little bit different texture than it was before. Okay, changes in skin and nails. Obviously, these are all the rapidly changing types of cells. So your skin cells, your hair follicles, your taste buds, all of that, those are all rapidly changing. So when you get treatment, those are the places where you're going to see changes, right? And then I also just want to call out emotional changes, because that's not always something that you see, but this is something that could be happening internally. Certainly reach out, and get the care that you need, both inside and out, as a whole person. Don't just, as African American women, we just like to get through it sometimes, or women of color, we like to just get through it. Don't do that. Reach out for the care that you need. Reach out to a friend that can help you and get you the support that will help you feel confident to keep going, okay? And everybody's side effect is different, so just kind of honor that as well. So we can manage side effects as well. I already kind of like touched on a lot of this, but I can't stress enough just nutrition and hydration. When you receive treatment, you want to just flush. You want the treatment, but you want to flush that back out of your system as much as possible, because these are sometimes heavy metals. It can weigh you down, or you just don't feel great. So the more you're hydrated, your body is like flushing this through, and your kidneys and all the other systems are helping you to feel better, and that'll help you rebound, okay? And again, everybody is unique. So I just wanted to we're almost to the end. I wanted to make a note about our integrative health services. So we have advocacy and navigation. It's provided by really all of the top health providers. And if they're worth anything, they will have some type of advocacy and support services to help you navigate through it. It's very complicated, so you really need someone to help guide you. Emotional and psychological support, of course. Don't feel bad about having to reach out for those services. They have some great coping. It could be just imagery, right? Like working through it, cognitive behavioral therapies, or you may need medication. Whatever it takes for you to feel better, that's all okay. Okay, you may do a massage. There are cancer-trained massage therapists who understand like what you're going through, and they know how to properly massage you. So don't feel like, oh, I can't get a massage. That may actually help in your healing journey. Acupuncture is also an integrative technique that many use. It can help with nausea and pain as well. So include that if you can. And then other complementary therapies. Okay, so I want to make sure that we feel empowered to use everything that's available to us. Then in aftercare, we want to continue to support each other, and if there comes a time that we do lose a loved one, there is grief services available. So again, just trying to be sensitive to the process and be very positive. Okay, so after your treatment is over, don't downplay anyone's treatment or say, oh, you're fine, there's nothing wrong with you, you don't look sick or anything like that. You want to still honor this is a healing journey over time. So still stay positive and supportive of each other. And of course, if you need support systems, there are support systems, there's online forums, there's just private, you could do an outreach or just reach out to a person that you trust one-to-one if that's what's best for you. And then finally, just in this part of the presentation, I just wanted to remind us that the Prophet, sallallahu alaihi wasallam, he said there's no disease that Allah has created except that He has also created its treatment. And this is related in Sahih Bukhari. So I just wanted to just remind us that all of this is included. We should not, as Muslim women, cut ourselves off from any of the care that Allah has blessed us with. He's provided the sciences to us. He's provided the knowledge. It is continually to evolve. They're starting to use AI integrated in. I mean, just the stuff that they're doing, the modeling is phenomenal. So definitely include all of what is available to you, because that is a blessing from Allah that's available to all of us. So I'll take a quick pause. I know it's a lot of information. I want to roll into the second little part, and this is just really like an interactive exercise and a support brochure for everybody to take home. Yes, thank you. Yes. Okay, yes, ma'am. Did somebody have a question?
I just wanted to bring this up about mammograms.
Yes, ma'am.
There's a thing called a thyroid card, and I knew nothing about it. I don't know how many of you have heard of a thyroid card. And I got a picture, but when you go to your mammogram, ask for that. It's a collar. It's a collar. And you put it on your neck to keep the radiation, because it can cause, without it, you can develop thyroid cancer. I don't have a thyroid now. I don't know if that was some cause of it. But they keep it in a drawer where it should be posted. So you ask for it, and it goes around your neck. I don't care what age you are. It's a thyroid. It wraps around your neck, and they should have it out and posted. So if they don't, it's a thyroid guard to get your mammogram.
And just a note about screening. So you really want to use. You want to do what's the best schedule that's appropriate for you. So if you have a family member, like within your immediate family, who has been diagnosed with breast cancer, colon cancer, etc., that could be tied to a genetics, you want to go a little bit ahead of that in your screening. You want to start screening earlier than the schedule. So you would be more in a higher surveillance type of category. So if you had, like for my dad and my brother, they both had prostate cancer. So for my other brothers, they would need to start screening 10 years ahead of that, so that you can catch it in time and then go forward from there. So again, screening has its place. Don't just count it out. Okay, Sister Aura. Yes, ma'am.
Your father, your mother, as well as pancreatic cancer. Because pancreatic cancer is something that so if you have members of your family who passed away with pancreatic cancer, make sure you start asking about check. Whatever it is, whatever it takes. And I think sometimes they can do ultrasound, sometimes you do CAT scan, you see your thyroid, your complete thyroid, because it's kind of like behind the stomach.
Yes. Yes. Sometimes those gastric cancers, they're hard to see, but that, yes, the pancreatic cancer can be very aggressive if you leave it. And so that's something to keep in mind. Thank you, Sister Aura. Okay.
No, I was thinking that I can hand this to people.
Oh, okay. You had
I just have a few announcements when you're done.
Okay. Any other question, and then we can kind of go over our little exercise if we have time. Yes, ma'am.
Awesome.
Yeah. So I include all that in integrative medicine. So, of course, we have some naturopaths, some certified naturopaths that are within the community. I would definitely use somebody that knows what they're talking about, and beware of just one-off case studies, because that, is something that we want to hear that, right? Like, oh yeah, I just drank some soursop, tea and everything's gone. You want to hear that, and you want that to be the answer, but that's not probably the answer. So you want to just keep it in perspective of, okay, is this causing me any harm? Herbs are extremely powerful. We cannot just count them out and say, oh, there's no side effects. Of course there's side effects. We just assume that we're just getting the positive side effect. So there could be negatives, like St. John's wort, whatever. It can cause you more problems than it is helping you. And sometimes it's counteracting what you're doing in your therapy. So if you want to use it, definitely include it with your physician so that you guys can put together a plan that's appropriate. Yeah, I don't want to tell anybody, oh, don't do that, and yeah, we're not doing that today. But it's sometimes people will want to use it, so please be in moderation. And if you are noticing changes, negative effects, sometimes they interact with each other. Sometimes it makes it worse. Sometimes it makes it less effective. So you really want to weigh it out and don't just assume because it's a herb, it's not going to hurt me. It can definitely hurt you. Okay, everybody has their packet. I know we're running out of time. It's I know even told me about 9:15, so I'm trying to hustle. Okay, so I made this little pamphlet. This is just an empowerment booklet for everybody. I wanted to just give that. I wanted to just give that reminder, and then we also have this little grounding exercise. That one isn't photo, but this one is this. So this is just 2 reminders. Take this with you. If you have a doctor's appointment or something like that, it's going to help guide you, because I know sometimes we get nervous when we go to the doctor and we forget about what we wanted to say, right? So these are just some reminders that Allah has already told us. We read about this month. He said, verily, this is in Inshira, verily with every difficulty there is relief. And he said it twice with emphasis. So it's serious, and he wants us to know that yes, you may go through a challenge, but he's gonna provide the relief. And then later on in Rome, he said, patiently persevere, and we hear patient perseverance over and over and over. Verily, the promise of Allah is true. Don't let that shake your firmness. And don't listen to other people whose firmness in their faith is also shaken, because we're on a healing journey, which is it's your physical, it's also your spiritual and your mental healing process. So you don't want that interrupted with a lot of negativity. So I wanted to kick that off. And then also just some tips when you go to your appointment on how to be prepared. You want to speak up. Use your voice. You want to trust your instinct. If something does not sound right, or if someone is putting you a plan that seems like the absolute opposite of what you think you really need, you need to say something, okay? Choose a provider who will listen to you. If they don't listen, you can fire your doctor. It's totally fine. You can fire them. And I added I've worked at both places. Both of them have very fine cancer services, so I've just included contact information for both Novant if you're in that system, and for Atrium if you're in the Wake system, okay? Both of them have very good cancer therapies. If you don't like somebody, choose another person, because this is a long journey, okay? And you are the self-advocate here in the middle. I just want to go over the do's and the don'ts. Stay organized, speak clearly, ask for plain language if you don't understand something they said. If they use a lot of jargon, say, could you say that again? I'm not quite getting it. Is it okay if we go over this again? Do a talk back type of process so that you understand what you're doing and why you're doing it, okay? And then you want to tailor your care warrior to someone who understands your needs and who's actually emotionally available and can manage that, because it's a long process. And then some things that I want to mention for don'ts. Don't assume silence is understanding. Don't minimize your symptoms. Don't rush your decision. And don't ignore your instincts, okay? So then if you're a caretaker, or if you find yourself as a caretaker, look at those care warriors' do's and don'ts. And then on the back, just some questions to ask in the Stay Informed section on the back. Okay, what is my diagnosis? What are the benefits of this treatment? Do I have an alternative? Because sometimes they're rushing and they don't go over all your alternatives. Ask, do I have an alternative? And then, how soon do I need to decide? You want to slow it down so that you can make an empowered decision. And then, can I use this integrative therapy? You've got some note sections. And if you need urgent care, just some tips to take with you, because I know it's very hectic at that time. So remember your medications. Take a friend with you. If you can't drive when you come back, if you have procedures that are going to sedate you, definitely take a friend. And don't feel like you can't ask. And I know that first one was like, think of somebody that you trust, that if you had an emergency, who would you call? And that's a big ask and a tall order. But I just want to bring that out. So I hope that this is just something that I wanted to put together. It's kind of like a little outreach ministry for me. I hope that that everybody enjoyed it. I'm going to try to develop more materials, just practical materials for everyday people, related to even your lab results, like what does this lab mean? Why do they say blah, blah, blah? What's on here? Let's dissect this together. And then what questions do I need to ask when I go back to the doctor, okay? So I want everybody to feel empowered and feel upbeat. I know in our first years of Nadira's, when we lost her, everybody was very misty, and I was like, I'm not doing this if we're going to be crying all night. We're not doing that. We're going to be empowered to take care of our own care, okay?
All right, thank you.
Inshallah.
And now give it up for Sister Michaela. Thank you, Sister Michaela, for all of that wonderful information and care you put into it. I have a few announcements. First, I just want to thank everyone who came out to support the Pink Iftar tonight. We appreciate your support, and all of those of you who helped cook and bring things out. Your donations were sincerely appreciated. There's a table over there with ribbons, as well as lots of informational fact sheets on various types of cancer and the test that you should get. Please grab some of that information on that table before you leave. And before the brother, he's getting ready to come up and make the adhan. While the brothers are cleaning up the chairs, please, sisters, if we can, meet as we always do in our spot to take our Pink Iftar photo in front of that sign. We would greatly appreciate it. And from the Eid giveaway today, the sisters got so many different materials donated, Sister Maida and Sister Jamila, that there is an abundance of things left over. So those racks outside, if you see anything out there that you want, please feel free to take it before you leave. And visit the bus. Thank you so much again, everybody. I'm going to close out with this prayer because I know these brothers are like, look here. I didn't get to finish my prayer. Right? Ya Allah, strengthen us as women of faith and purpose. Help us support one another, uplift our community, and use our voices and actions for good. Accept our fasting, our prayers, and our service during this blessed time. Bless the food we shared tonight and those who prepared it. Unite our hearts in love, mercy, and sisterhood. Ameen.